Hey everybody. I don't know if you've noticed this, but I've really found a great uptick in the media reporting for children dying of COVID in the U.S. As a father of young children, of course, this is concerning to me, and so I investigated this topic and wanted to give you some perspective of what children very sadly die from in the U.S. And so I got some data from the New England Journal of Medicine, a study entitled Major Causes of Death in Children and Adolescents in the United States from 2016. This is a premier medical journal, very high quality data, okay? And now I used a death rate published in the in Great Britain, okay? This is a preprint study called Deaths in Children and Young People in England. And this was reported by the BBC on July 9th and Nature in July 15th, okay? And their death rate is 0.2 per 100,000 children, okay? We cannot use a death rate for the US because we don't report that number. We actually track children who have died while testing positive to COVID-19. We don't actually check and report if they have live virus or if that's their cause of death. So we don't have that information, at least I haven't seen it. So I'm using that number. If you want to argue with me and say American children are something than British children, that's, we can have that argument. But we're going to use that number today. I'm going to give you some perspective really quick. Okay, so if we use that data, a child has a 26 times greater likelihood of dying in a motor vehicle collision than COVID-19, okay, 26 times. 11.85 times greater risk of dying of cancer, 6.35 times greater risk of dying from drowning, and a 2.2 times greater risk of dying by fire, by a fire injury. And so there's our kind of perspective. And I had a conversation, I was having a conversation with a school board association, and I'm a state senator here in New Mexico, and a colleague of mine who I have great respect for, he's across the aisle from me, he said, but Greg, if we can just save one kid, we were talking about mandatory masks and all these regulations, and he said, if we can just save one kid. And I appreciated his drive there, but if we have that kind of attitude and we're going to make children play saxophones inside space pods and wear 2 masks and do all these things, are we going to get 26 times greater craziness than that to prevent motor vehicle collision death in children? Are we going to go and be 11 times as strict to try to prevent and screen children for cancer? Are we going to do things like outlaw swimming programs in pools because there's a 6 times greater risk? So I just, we have to keep this in perspective. I realize COVID is not just about kids. I mean, it's obviously primarily about the elderly and folks that have pre-existing medical conditions. But when the media is reporting like this, we have to put some perspective in it. When we're trying to develop policies for our schools and our young people and our daycare centers, we have to keep this in perspective, okay? I hope this is helpful. Obviously, we're not going to take these numbers as anything as final, but I do think they're very fair and very accurate. And I think if we consider these things and have conversations with people about COVID, about, hey, your child is at greater risk of dying from this, and this than COVID, I think people may settle down. In my medical practice, I've had people call me in tears and people that are very scared about their children dying. So it really is a legitimate thing. I think it's something we need to be talking about more honestly, more openly. Okay, take care.